Welcome, my name is Dr. Robert Polisky. I'm a board-certified dermatologist and I'm also board-certified in internal medicine. I came out to Alexian Brothers Hospital in Elk Grove in 1987 and I've been practicing ever since then at this one location. I'm involved in teaching, research, and most of all, patient care. Laser was created for a wide range of purpose. Its gold standard is a very fine collimated beam of light that gets a target that's very small. By opening it up, we fractionate the laser and use a new quality that allows us to treat larger areas of skin. We can treat everything from acne scars on one hand to fine lines and wrinkles on the other, and that can be an effective way of getting rid of lines and wrinkles. Now, I've been involved in laser personally for over 15 years. I put together a course called The Skin is a Material for the material science engineers. I've also worked with CO2 lasers and dye lasers, and I can tell you, lasers are a tool that have tremendous potential. However, the key thing is bringing that information across to the patient. Patients need to know that there's downtime involved, and different lasers can do different jobs. For example, dye lasers can get rid of red marks. Gentle lace can get rid of unwanted facial hair. However, no laser can do it all. That's why a consultation is so important, to know what are the options the patient has. Everything from at-home creams to advanced procedures in the office, and then there are things somewhere in between. One maxim is what you put in is usually what you get out. That doesn't always work in life, and we find it in medicine as well. So it's really getting the right target, finding the patient who's most suitable for the procedure, and has a little bit of downtime to play with, maybe 3 to 5 days where they might be red. Some patients might be red longer for 7 to 10 days. Other patients insist on so-called lunchtime procedures. Those sound good, but a lot of times they don't accomplish very much. One thing I get asked about at least once a week is, what about a mini facelift? Well, don't forget that those only last 2 to 4 years, and another problem with the mini facelift is they are an invasive procedure. That you can have infection and bleeding, and although you can get good results, you're only working on mini part of the face. A CO2 laser, CO2RE, would work on the entire face, allowing us to blend it. That procedure we just saw, we were able to use that same tool in a number of different modes. Modes are a way of treating upper and lower parts of skin, penetrating a small amount or a great amount of skin, and allowing us to pinpoint really large flaws and just dust over small flaws. So I would hope that patients who have questions will come to someone who has been practicing and working in the field of dermatology and give them advice on how they can best treat their cosmetic concerns. Today we saw a CO2RE laser, the latest development by Candela Syneron. That's a company I've worked with in a lot of different capacities over the last 10 to 15 years. And although I have no financial interest in the company, I've been impressed by a steady stream of technological improvements. One thing about CO2 laser that makes this better than many of the others is it allows a lot of different modes and capabilities. That flexibility we can translate from the laboratory to the patient and be able to address a lot of his or her concerns. So I hope that if you have questions, you won't hesitate to bring them to us at Elk Grove Dermatology.